That's what I'm talking about, talking about, talking about. That's what I'm talking about, talking about, talking about.
Hi, you're watching Talking About. I'm John Griffith,
Liz Glazer.
and we are joined by
I'm
somebody
not Ruben.
Yeah, not Ruben.
This isn't like Bewitched, where
Well,
the
who are
commercial
you?
goes and the new Darwin is right there. No, I'm Damon L. Jacobs,
Welcome back.
licensed marriage family therapist and author and sexual health educator.
Yay.
Yay!
That's wonderful.
Let's talk. I'm so glad to be on Talking About. I just love this show.
Yeah.
And I think it's so relevant given everything we're hearing tonight, everything we've been experiencing, that we just continue to have these conversations and talk about the things that we need to talk about.
And we do want to talk. I want to get the phone number up early and often because this is
My phone number? Are you going to give away my phone number?
Oh, honey, that's all over the internet.
Okay.
So this is an open dialogue. Feel free to call in 718-460-9434. Okay. So you are here to talk about tonight.
So there's a lot of things I do, but I think what's so relevant, especially for what you were talking about with Ruben, is this theme of self-care and how important, especially now,
Yeah.
self-care is. Not only because it benefits the self,
Right.
but we have 4 years, and maybe more, but we have at least 4 years of some very, very hard work ahead. And it's very important that we all seriously ask this question. In maybe ways we haven't had to do before. What does it mean to care for yourself? So if you don't go to a march, or if you do go to a march, or like you were saying earlier, if you just need to like chill out
Yeah.
and be in your safe space,
Yeah.
I would encourage you, go with that. Follow that. There are going to be plenty of times that you will have a chance to be active and stand up and protest or do things in the next 4 years. So you don't have to do it all now. But if we think about what it means in this administration to truly care for our bodies, for our minds, for
Yeah.
our spirits, in the context of an administration that probably would rather us not do that.
Yeah.
That, in my mind, is a revolutionary act.
Uh-huh.
Because if we want to exist and we want to be healthy and strong and enjoy pleasure and connections and relationships, even though they're painful sometimes, and I'm
Right.
sorry about that.
Oh, that's okay.
But we want to
Thanks.
be able to do that
Yeah.
when the hierarchy says, we don't want you to feel good about yourselves. We don't want you to feel good with others. We don't want
Yeah.
you to have health and happiness and success. So for us to subvert that is revolutionary. And I really believe that this calls upon all of us to consider that at this time. Self-care is a revolutionary act.
Totally. I love that perspective.
Thank you.
Yeah.
Thank you.
That's wonderful.
And, you know, one of the things that in that context then has concerned me, that's come to my attention in this last year, even before this political administration, is what's happening in terms of our health issues in the LGBT community, particularly something that most people are not aware of, that is eliminating 30,000, killing 30,000 LGBTQ people every year.
And what's that?
According to the Center for Disease Control, that is tobacco smoke.
Wow.
So, to put that in perspective, consider, now I'm I'm a sexual health advocate, HIV prevention specialist, sometimes activist, I guess, one might say, some might argue that. But
Why is that?
well, because I believe more in education
Okay.
than activism. And sometimes activism, for some people, means acting in a way that's critical and disrespectful and hateful towards others.
Oh, interesting. Okay.
And that's not the line I take. I think education and love and compassion are very powerful tools for
I'm with
movement
you
and change.
on that. Yeah.
And so I've been working with HIV prevention for about 25 years now.
Uh-huh.
And although things are not perfect, they're better. They're better than they used to be.
Yeah.
We're down to 12,000 12,000 deaths in the U.S.
Yeah.
every year. About
Yeah.
12,000, give or take, HIV-related deaths in the U.S. every year. Now, compare that and consider 30,000 LGBTQ identified
Yeah.
tobacco-related deaths. And this
Right.
is all coming from the CDC, so anybody could look this up on the cdc.gov website. Where is the outrage about that? Where are the protests? Where are the petitions? Where are the parades? Where is the outrage? Or are we just complacent that, like, oh yeah, well, that's just a thing and we just have to deal with it?
Okay, and so take me back a little bit. I understand the way that you put forward these numbers, and so HIV deaths go way down, and then you've identified through your research that there's a spike. Is that true? That there's a spike?
It's about the same, as far as I can see, as far as what the CDC is saying. It doesn't really go way up or down. Just 30,000 seems to be the number.
Yeah. No, but I'm saying from an earlier point in time.
I don't actually know.
Okay.
I'm not certain.
Got it.
I imagine it was probably higher before when people were smoking more.
Yeah. Right. Okay. And there are specific numbers related to the LGBT community.
Right.
Okay.
That we are twice as likely to smoke as our heterosexual counterparts.
And
I am a former smoker.
me too.
Yeah.
Yeah. So, and do you have, as part of your research, a theory about why?
Quite a few.
Okay.
And many people, this isn't just me,
Yeah.
many people have speculated. One, and the easy sort of hit on this is the way the tobacco company markets cigarettes to our community.
Okay.
There have been campaigns to make, as they always do, to
Okay.
make cigarettes seem like they're cool, like they're fun, like you're part of the crowd.
Yeah.
But GLBT folks, our community in general,
Yeah.
we do have vulnerability to depression,
Yeah.
to stress, to trauma, to grief and loss. And nicotine is a stimulant, which often helps with these feelings. And for a lot of people, sometimes they start smoking at an early age when they're alienated, when they're lonely, if they've been rejected by a family, or they've begun to become accepted by the gay lesbian community. So they
Right.
start to smoke, and it becomes part of a ritual. It becomes part of a relationship. And so smoking becomes part of just this daily habit, which is
Yeah.
associated often with pleasant things,
Right.
or a way of feeling better when I'm feeling something unpleasant. And I don't think that's not a moral stance. I'm not morally opposed to any of that.
Well, I mean, it doesn't sound like you are. It sounds like your angle is people are dying. I don't want people to die.
Yes.
And so and this was the thing about what I read about your research that I thought was really cool, was that you take the harm prevention work that you've done in connection with HIV, and then you've analogized that to the smoking realm. And so whereas PrEP is a harm prevention technique that the LGBT community and others can engage, yes,
Right.
for HIV prevention, so too can there be techniques that can be used for death prevention from smoking-related diseases.
Exactly. And
Okay.
that you hit the nail on the head.
Okay.
Because what we've seen in the HIV world
Yeah.
with PrEP, that stands for pre-exposure prophylaxis, a daily pill that prevents HIV,
Yeah.
used by people that are HIV negative. And for people living with HIV, that the medications now are so powerful that medically speaking, we know that somebody living with HIV who takes meds and is undetectable for 6 months or longer is medically untransmittable.
Yeah.
They cannot transmit
Right.
HIV to another person. Because of these advances in science and this
amazing.
advances in
Absolutely
information,
amazing.
we have seen new HIV rates drop in
Yeah.
this country for the first time in over 20 years.
Wow.
For the last 20 years, they hovered around 50,000. They wouldn't go up, they wouldn't go down.
Okay.
And the CDC just announced only 39,000 new HIV infections in 2015, which is still 39,000 too many,
Yeah.
but that's a significant drop. So
Totally.
I looked at that and I was like, look at what we're capable of doing
Right.
when we have education, information, and access. We still have a long way ahead of us, but
Yeah.
look at these gains.
Yeah.
Could we apply that
Yeah.
to smoking as well?
Yeah.
Is there something that we've learned from PrEP and from HIV prevention and treatment? Could we use any of those tools to bring down these numbers of deaths in the LGBT community every year?
And so when you talk about the tools, maybe elaborate a little bit about
Yes,
that.
please.
So this is all, as you mentioned, harm reduction.
Yeah.
Now, in harm reduction, it's not seeking to tell people what to do with their bodies or saying you have to quit or you should quit. Not that you didn't say that, but this idea that the medical profession usually says, if you're a smoker, the only option for you is quitting. And if you're not willing to do that or able to do that, sorry, I got nothing for you. Come back when you're ready.
Yeah.
In harm reduction, we use other tools. In harm reduction, we look to see where are you at now?
Yeah.
And given where you're at and given what's meaningful and relevant to you,
Yeah.
are there ways to reduce harm? Are there steps you can take to reduce harm? So when it comes to smoking, that could be cutting down. That could be reducing. That could be saying only certain hours of the day. Or that could involve something called vaping. And vaping, and many New Yorkers have seen people
Yes.
who vape, but vaping involves heating the nicotine instead of smoking it.
Okay.
Heating a vapor, which
Yeah.
then delivers nicotine into your system,
Yeah.
versus smoking,
Right.
which involves burning about 3,000 carcinogens that you inhale into your system, which
Yeah.
then results in a lot of throat cancers and lung cancers and unhealthy stuff.
Yeah.
That has been seen to be much, much, much less, not zero, but much, much less risky
Right.
with vaping.
Okay.
So what if people adapted vaping or tried vaping instead of smoking? Could we see those 30,000 numbers go down? I don't know, but I want to find out.
But yeah,
Sure.
it's a great possible first step.
Yes.
Or even if people don't transition to that, say, okay, I want a cigarette right now. I want a cigarette right now. Okay, but I want to quit or I want to slow down. So every time I feel I want a cigarette, I'm just going to wait 10 more minutes.
Right.
It's beautiful.
And you're smoking less ultimately because you're stretching it by 10 minutes, which is not an unreasonable amount of time.
Sure.
And hopefully with more time, you can spread that out a little bit more and be a healthier person as a result.
Beautifully stated. And in those 10 minutes, I would say, so what are you feeling right now? What is it you think a cigarette is going to help you feel? And what is it you don't want to feel? And I know for a lot of people, breakups are triggers when they have relied upon nicotine and cigarettes in the past. And then when something painful or they're experiencing a personal loss, they will go back to what they know, which is often tobacco. So in that case, I would say, so what if you waited 10 minutes? Let's just think about what is it you're trying not to feel at this moment? And often the answer is pain.
Right.
Because harm reduction, a lot of times, is just recognizing it's not that people don't want to feel pain, they just want to control pain.
Ah.
And that's an important distinction from the abstinence model. Right?
Yeah.
So what if waiting those 10 minutes allowed you to just be able to sit a little longer with pain or grief or fear or confusion or anger, whatever it is?
Yeah.
And people started to get in the habit of delaying that. Then I think we would see those 10 minutes turn into 20 minutes. Maybe those 20 minutes would turn into an hour or so. But that's exactly what I mean by a continuum of harm reduction, whereas most doctors would just say, quit or else.
That it's this
Yeah.
all or nothing.
All or nothing.
Exactly.
Yeah.
Yeah.
And so, what are the particular challenges? Because I imagine that in order to roll out, some kind of programmatic effort to implement harm reduction of this ilk in the LGBT community, there's got to be some kind of marketing campaign related to like making vaping look as cool as smoking. Is that?
Maybe. I'm one person. I'm
Yeah.
not an organization. I'm not an activist.
Yeah.
So
Yeah.
what I'm seeking to do is similar to what I was able to do with PrEP 4 years ago,
Okay.
where again, just as a person, just as a
Yeah.
therapist who really, really loves and cares about his community, was beginning to get the message out and trying to stimulate these discussions and using social media and Facebook
Cool.
to engage people in these discussions and help them learn the science and the information which they may not have been told about by their own doctors.
Sure.
So whatever decisions they can make, they could do it based on empirical evidence and facts versus speculation, or this is what I heard or read on the internet. It's great you're asking about that because I am facing a lot of resistance to this within the LGBT community. And
Oh,
some of
really?
it is just like, A, we don't want to talk about it.
Okay.
B, we have so much more on our plate.
Okay.
And C, some people have just never even considered this because our focus, rightfully, for so many decades has been on just staying alive
Exactly.
and treating and preventing HIV. And it's like everything else sort of fell by the wayside.
Right.
But I think mental health is still an issue we are not openly talking about. Cigarette smoking is an issue we're still not talking about. Interpersonal violence and domestic violence in relationships is still an issue that's really taboo to talk about in health communities. But these are all issues we're grappling with. And I think it's so important that we get them out there and reduce the stigma and shame about talking about them.
Right.
Yeah.
And we have Damon with us for another 15 minutes or so. So if you want to call in, the number is going to pop up on your screen. I'm not Liz, but here comes the phone number. It's 718-460-9434. Please call, please ask questions, please interact with us. We are here for you. Okay.
Thank you. So these dialogues that haven't typically happened,
Yeah.
that I think need to happen, that are worth happening, and that we can talk about because we're on talking about right here. Yeah.
Yeah, so what are further, so imagining the dialogues that you want, what are the conversations that you want to be having with people?
Well, I would love for people to go to my Facebook group, which is an open group. That means anybody can go to it, anybody in the public. It's called Smoking, Vaping, Heating,
Okay.
Rethinking Nicotine and Harm Reduction in the LGBT Community. It's a long title, but it's really easy to find. And again, this is not the only way, but I have found that Facebook really is an interesting platform to use for these levels of conversation, connection, and education. And that people can go to smoking, vaping, and heating and just find it as simply as that and see, what we have been talking about for the last few months, the research, the articles that have come up.
But just from being part of some of the communities that you've built already, I can see that the dialogue takes place and the majority of people are very supportive and open and working towards something better. Occasionally you get somebody who's a little too spicy for it, and you creatively shut them down without being degrading to them, and that's a wonderful environment.
Thank you. That's been, so thank you, Jonathan, because that's really important to me as an educator, not to shut down the conversation, but at the same time, to keep it safe enough for people to be able to come to a group and feel like they can share.
And sharing with us right now is Victor. Victor, you're on the air with us. Do you have a question for Damon?
Yeah, so I know, has there been a lot of research on vaping? Can you hear me, guys? Okay?
Research on vaping. Has there been a lot?
Yes. So there's actually a lot.
Yeah, so just that vaping is a newer technology. Is there a way, do you guys think that there might be unknown health risks associated with that?
I couldn't hear.
Unknown health risks with vaping.
Yes, of course. Okay.
Great question.
So vaping, the technology has really only been around since 2007. So although that was 10 years ago, of course, there's still things we don't completely know or completely understand. What we know from over 6 decades of cigarette use is that, there are definitely risks that are clear and defined and, unquestionably medically with tobacco cigarettes. With vaping, if you go to you could Google Public Health England. This is most of what we know about vaping comes out of the UK and comes out of their government.
Okay.
It is their studies where they said, and this is their government website saying this, vaping is 95% less harmful than smoking.
Huh.
They're not saying zero harm.
Right.
They're saying less harm.
Well, that's your whole thing is reducing.
Victor, are you a current smoker or do you vape?
I used to be a smoker, but I don't now.
Okay.
But I have an occasional cigarette when I'm drinking.
Okay.
Now, that's a great example of harm reduction because he used to smoke regularly. Now he smokes when he drinks.
But it's actually one thing that I find interesting just thinking through, Victor's particular pattern of smoking is, so in order to vape, you've got to own a receptacle, right? If, Victor, you are such an occasional smoker that, I imagine, do you buy your cigarettes or do you just bum one?
Yeah, I bum them from my wife.
Okay.
Right. He bums them from his wife. Okay. So, right, but I think that's an interesting case because then it's at least, I think what you're doing is great. And I don't mean it to be overly argumentative, but one could argue that if introducing vaping to somebody who's an occasional smoker, such as Victor on the phone, then that might up Victor's consumption of nicotine, right? For the very occasional smoker.
Yeah, that if you give somebody a safe way to enjoy this, that they might want to do more of it.
Right, like snack wells.
Right, like PrEP.
Yeah.
I mean, that's been one of the arguments against PrEP as well.
Great, okay.
And where I come to with that is just saying it's not up to me to tell anybody. I can't. I have no power. I can't tell Victor. I can't tell anybody what to do with their own bodies. What they have found in these studies is that you do get a mix. Sometimes you get smokers who vape, and that's a step towards abstinence.
Right.
And they eventually do quit nicotine altogether. And other people never quit, but they continue to vape. I wonder, did Victor say if he, Victor, have you ever tried vaping or what that experience was like for you?
I've only vaped in California, and it wasn't tobacco.
Okay.
It wasn't.
It wasn't tobacco.
Okay. All right. And again, harm reduction. Other things that people smoke can be a lot less harmful than tobacco cigarettes.
Yeah.
Right? Now, so again, it's just the whole point of this is just having options.
Yeah.
Options that we haven't had before. Options beyond the dichotomy of smoke or quit.
Right.
And for some people, vaping is a very reasonable option. And for some people, it's not for various reasons.
Yeah. So, essentially, Victor, is find the information to help you help yourself make healthier choices for yourself, and one foot in front of the other, and you'll get there.
And join my Facebook group. I'd love to see you on there.
Yeah, definitely.
Smoking, vaping, heating.
All right, thank you for calling.
Join me.
Thanks for calling.
All right, bye-bye.
Yeah. What's so interesting about England is that they're so in favor of vaping, but they have been so opposed to PrEP. And they've kind of been exactly opposite of the U.S. in this way. So when PrEP was first found to be effective in preventing HIV, our FDA took relatively quick action, and they approved it almost immediately in the summer of 2012.
Okay.
So that insurance would pay for it, and that people would know about it, and we could start to see these dips in new infections, which we've seen.
After, about 4 years of it starting to come into light? It took about 4 years?
Now, it's finally those numbers are starting to go down. And it did take 4 years. But at least our government and the FDA reacted pretty quickly to PrEP.
Yeah.
But they are resisting, and they are just like fighting this vaping thing tooth and nail.
Do you
And
think-
in
I
the
mean,
UK, it's exactly opposite.
sure.
They are fighting PrEP tooth and nail over there. They don't want to pay for it. But their National Health Service, the NHS, they pay for people to vape instead of smoke. If a doctor has a patient, and they want that patient to quit smoking, and they write a prescription, and that patient uses it, their NHS public health system will literally pay for the e-cigarettes, but they won't pay for PrEP, and they're fighting it tooth and nail. So it's this really interesting difference in harm reduction approaches in these two
What
different
do you
countries.
make of that? Like, why do you think that is?
I think some of it might be financially incentive, and some of it is morality. I mean, I think in England, they're just still very much living in a world where what's HIV is equated with gay men, which of course is not always the case.
Right.
But they think that, I think there's a lot of homophobia involved with this whole we won't pay for gay men not to become HIV positive thing. And surprisingly, in America, again, we got on that, but the e-cigarette resistance is pretty high.
I think you're on the right track with stigma.
Yeah.
It all
Right.
comes down to it. I mean, so you just said, this is off on a tangent, but the first person who I knew in my life who told me that they were HIV positive was a heterosexual woman. So there you go.
Yeah.
Right, and that PrEP offers, again, an opportunity for all women or men who could be at risk for HIV, to, especially in the U.S. where it's paid for, is to get us to a better place. So can't we use those tools for vaping? Can't we critically look at that 30,000 number and see about ways to get that down? And that's really what I want to be talking about in this year ahead. Yes, sexual health and PrEP and HIV, and yes, the radical self-care that I think is important for all of us to be engaging in mentally, physically, emotionally, spiritually. But to really look again what that means for us and how smoking might make it hard. I wrote in an article, Trump and his administration may have an agenda about making our lives bad, but we don't have to make it easy for them.
Right.
We don't have to make their job easy for them. We
Yeah.
don't have to smoke ourselves into an early grave and do their job for them. We can resist.
Yeah. Well, I think, thematically throughout this show, that's been a really inspiring message for me, is just, the resistance through self-care. The resistance through, through speaking out. Because, I don't think that Trump values the First Amendment in the way that I have thought of the First Amendment being valued. But that doesn't mean that, amazing art can't come out of this tragedy.
Yeah.
And similarly, too, it's possible that during this administration, people can take it upon themselves to be healthier.
Yes.
Maybe even healthier than they would have been before.
Yes.
And linking this all back to my breakup,
Yes.
And that's a laugh at your breakup. I'm just laughing at
it
the
was
link.
intended to be
Okay.
funny. But it's fine to laugh at my breakup. I have
Okay.
been laughing at my breakup, and I would love for all of Queens to laugh at my breakup, particularly because the person who broke up with me lives in Queens. So, but I have tried to take it as an opportunity to be even more connected to myself than I was before the relationship. And I feel like what you're talking about, what Ruben was talking about, what we talked about collectively during the hour was basically digging in your heels and figuring out okay, this is not an ideal outcome based on what I wanted. but that doesn't mean it's not an opportunity to take stock of what was already there, you know, before something bad happened. And with respect to smoking, I think the work that you're doing is great.
Yeah.
And with PrEP, you must have really lucky clients.
Yeah. And
Truly.
I am lucky to get to do the
we're
work.
very
Yeah.
short on time.
Okay.
So where can, just if you had one quick statement to get out there.
Yes, DamonLJacobs.com, Damon L, don't forget the L, DamonLJacobs.com, or Damon L. Jacobs on Facebook, or Smoking, Vaping, Heating. You can find me any one of those places.
Okay.
Thank you, Damon.
Thank you.
So happy to have you with us.
Thank you for talking about it.
Thank you, and I'm so happy to have you.
I'm so happy to have been
And where
here,
can people
John.
find out more about you again?
Oh, well, you can call me,
Call you what?
right? Maybe.
Okay.
So- no, I'm on Instagram at Liz Glazer.
Okay. Okay.
I'm on Facebook.
Okay.
I'm Liz Glazer all the time.
And I'm at talkingabout_TV. That's this show. www.talkingabout.info is our website. We have a YouTube channel. We're all over the freaking place. And thank you for being with us.
Thank
both of
you.
you. And we will see you again next
Thank you.
time.
Thank you.